Okay, it is 1 o'clock in the afternoon in New Jersey. And hello, New Jersey. We're going to get started. I do want to say, just out of respect to our guest today, ni hao to any visitors from China who are watching, because we have another great broadcast for you today. This is a brainchild of many people. And I'll start by acknowledging Kimberly Marcus, the former Commissioner of Education, former Assistant Commissioner Penelope Latimer, Karen Garver, former Chief of Staff for the Commissioner. We also have Professor Extraordinaire in the world of early childhood, Stephen Barnett on, as well as myself as the host today. I'm just trying to match the energy of Penelope Latimer last week, who did an awesome job with our guest, Scott Rocco. So today we are going to talk from Rutgers University. We have some visiting professors from China. And we also have Stephen Barnett from the NIEER Institute. It's the National Institute for Early Education Research. And these professors today are going to share with us some research that they have done, because we all know New Jersey's been struggling quite a bit for the past few months in dealing with COVID and reopening schools. And what did we say? Well, where can we get some research to people who have open schools, and how can that help us today? So today we have two fantastic people also from NIEER that are joining Stephen. Today we have Zijia Li, Dr. Zijia Li. She's joining us today. And we also have Dr. Lin Li, and they are going to go through some research that they found from other countries, including China, and trying to compare our state plan to give us some tips to move forward. So without further ado, we are going to start with Stephen. Can you tell us a little bit about the tools that NIEER has put together today, or put together over the past few weeks, to help districts in conceptualizing reopening their schools? So welcome, Stephen, tell us, where do we go from here?
Thanks, Mike. We've developed a matrix. It's really just a spreadsheet that sets out the key decisions that people are going to have to make in thinking about reopening schools. Helps you organize that by setting out, we set it up in 3 scenarios. You can change it however you'd like, but the 3 are basically, we're going to be full remote, we're going to do some kind of mixture is the second, and the third is we're all in. And schools may have to plan for all 3 of those. And the key areas are basically procedures for opening. How do you decide when to open, when to close? When you do that, then what do you do? What do you need to do for student and staff health? What do you need to do for transportation, arrival, and departure? Instruction, facilities, cleaning, hygiene procedures, meals, special education, sports and extracurricular activities, supervision, professional development, and teacher evaluation. How do we handle those? So that's basically what the instrument does. And then we've populated versions of this, one with information on New Jersey, Pennsylvania guidance, California guidance, 2 of the best states in terms of their guidance. And then with what we've learned from a set of other countries, including China.
Well, would you say that there was something that really stood out from these lessons from other states or other countries?
I think several things. With regard to getting in and out of schools, New Jersey's guidance does not require temperature taking. We didn't find any country that didn't do that. They all require at least once a day temperature taking. Most of the countries set priorities for return to in-person instruction, often by age. Most of them stagger their arrival and departure times to limit the kind of crowding up, getting in and out. Most of them try to create stable clusters, right? So kids come to homeroom and they never leave. Right? The teachers rotate if they have subject matter changes and they need to do that, but the students don't. I think what's also surprising is what's not addressed. really none of the countries address supervision, evaluation, professional development. Very little, other than saying children with special needs should be prioritized for in-person, really not much guidance. Nothing really about extracurricular activities. I think largely because outside the US, those are mostly not in schools. And really not a whole lot about curriculum delivery and modification. Again, so there's a lot of guidance on some things, and other things we're kind of on our own.
Well, so can we touch upon a few of those that I think are really important? So one, I think we're hearing the term guidance a lot, right? I mean, I keep hearing guidance, and you mentioned that there's been no real directive. Those are two different terms, right? So you've got guidance and considerations, and then you have directives. But the first one you started with was temperature, where you felt like there was some absence of a directive for temperature. Why do you think that we're seeing that?
I don't know. I don't know if folks thought that's too difficult for schools to do. I just saw today, you can buy thermometers that are internet connected. If you use those to take temperatures, you could have the data automatically populated for every child every day in a district database.
Wow, that's great. I know a lot of schools.
Why wouldn't you want to do that, right?
I agree. I see a lot of schools taking temperature reading pretty seriously, although it's not a directive. So they are buying handheld readers. They are buying pretty expensive readers that actually can do up to 60 in a minute through walkthroughs. And then even probably the most expensive would be something that was internet connected with a facial recognition in terms of temperature. That's pretty amazing. I do want to touch upon another one, and this is really anybody could jump in at this point, but I will follow a flow of this program. But you mentioned age in terms of clusters, that other states or other countries have really focused on bringing certain age groups back at a particular time. But we didn't see that necessarily in New Jersey. We don't see it a lot in California either, right?
Yeah.
So why do we think that is? And why would other countries focus on bringing certain age groups back a little earlier?
I saw three considerations. One was the younger the child, the less likely it seems they are to be at risk. Right? So in terms of relative risk, or younger kids at less risk. And then there's the education format, much more difficult to provide a good education for the youngest kids remotely, and less need for them to move around within a school than older kids. And the other end of the consideration, though, was some places where older kids were preparing for exams and graduation. They were prioritized for in-person education because the high stakes in some countries.
You didn't mention a word that I thought you were going to bring up, is economics, because it's much easier to return back to work when your children are at school. So I thought maybe you would have mentioned, and I don't know if it was a part of their decision-making, but if middle schoolers and high schoolers are home, it's a little easier for parents to go to work as opposed to having an early childhood or an elementary age student.
Absolutely. I think that's also a consideration, but it varies. In countries that have a lot of three-generation households, less of a concern.
Wow. So, one of the countries that I really want to learn from, and we've been talking about from the beginning, it's because it's the country that's been dealing with it the most. And I see Dr. Lee and Dr. Lee shaking their head now. I would love to hear from each of you or one of you about what you've learned in terms of research and taking a look at the model that's occurred in China. So welcome. Hi, how are you?
Hi. Thank you for having me. Thank you for having us. Yes, just now you mentioned when to reopen and what group should come back first. Here, I think I can share with you some of the Chinese experience, what they did on this issue. And the Chinese government considered this the school reopening issue very seriously, even at the beginning of the pandemic. So on February the 28th, the Ministry of Education forward 3 main principles about when to reopen. So the first one is the school should not reopen unless the epidemic is basically controlled. And the second is schools should not reopen unless they can meet the basic requirements and standards of prevention and control. And the third is schools should not reopen unless they can guarantee the safety and health of the staff, faculty, students, as well as the campus. So let me give you an exact example of Shanghai. Shanghai, first, there are several important time points. On the March 24th, yes, Shanghai has lowered its public health emergency response from the first level to the second level. And then on April the 23rd, the Shanghai has no new local cases for consecutively 31 days. So 4 days later, on the April 27th, the educational committee announced that schools should reopen to all these students because they are preparing for tests and graduation, just like Steve mentioned that. So then after that, on the May 9th, the public health emergency level has relowered from the second level to the third level. That means all 16 districts of Shanghai, they are in low risk. So all other grade students come back to school gradually. And finally, on the June the 2nd, yes, the grade 1 to 3 of primary students and those kindergartens, the public kindergartens, they return to school. Yes, and what I want to mention here is that the kindergartens in China, they have the little bit different from here. They serve the children from 3 to 6 year old children. Overlapped the pre-K and the K here in the United States.
So when you're talking about districts, I just want to put it in proper context. So New Jersey has over 600 school districts, and some are quite large with tens of thousands of students, but some have 100 students in them. When you talk about districts in terms of Shanghai or other districts in China, how many children are they servicing?
What I mean the districts here is not the school districts. There are much more school districts. There are the political districts in Shanghai, 16. Yes.
Oh, 16 political districts. Okay. And you're talking about millions of students.
Yes.
Gotcha. Okay. So what did you find in terms of, aside from policy, were there other unique policies that were put into place so that the schools could reopen, aside from the urgency for testing? I read that a few times, and I heard that in order to get testing underway, schools opened. Were there other policy changes that were put into place and other reasons for getting kids back into schools?
Okay, so
Zijia, can you lean in a little bit to the computer? Actually, Lynn, can you slide over so we can hear Zijia a little better?
can you hear me well now?
Perfect. Yeah, much better. Thank you.
Okay, thank you. So I was just talking about that there has been a lot of changes in the system in order to fulfill the principles that Lynn had just mentioned to assure a safe and healthy school reopening. So one thing first, a series of preparation has been performed before the campus or any facilities are ready to open. So what they need to do is first, there is a self-checking procedure for students by their parents. The parents should complete a checklist, a self-evaluation checklist for a certain amount of days, to assure that to log their children's basic health condition travel history, or any contact with a high-risk community. The completion of this checklist determines the eligibility of returning. And the parents should also sign a health and safety assurance to agree with their responsibility. And for example, in Beijing, all students who are considered to re-enter the campus should complete a self-evaluation checklist for 14 days. So they need to check their activity and health condition for 14 days by their parents, including recording body temperature, any sign of symptoms like dry cough, fever, tiring, nasal congestion, stomach ache, or diarrhea. They're also required to report their travel history. And then parents sign the commitment for their personal responsibility regarding campus returning. So besides the students, the core of the campus, the staff and the teachers are also required to complete a self-checking. And in Beijing and Shanghai, a large proportion of the staff were traveling back to their hometowns during the Chinese New Year when the pandemic started. So when they return back to work, some districts in Shanghai requires all personnel who had traveled outside of Shanghai and were returning back to work to go through a stay-home health evaluation. Schools also providing both viral and antibody tests for their teachers and staff. So besides the personnel side, and for the material preparation, as recommended by the Ministry of Education in China, schools should prepare adequate PPE and disinfecting supplies for at least 1 month's use, including masks, gloves, protective suits, and sanitizers, thermometer, and hand wash facilities. In addition, the school reopening committee in each school should revisit the floor plan of the campus and pay special attention to areas where students could get crowded and make corresponding plan to prevent large group gathering in those areas. School also need to set up a medical isolation room for any urgent use. And the temporary parking spots near the campus should also be reorganized and prepared well to facilitate the traffic flow during the morning and afternoon traffic peaks when parents are dropping off and picking up their children. So this is the preparation stage. Is there any?
Those were great. I'm so happy we are recording this because I have the urgency to keep writing as you're speaking. Because to any superintendents out there watching this now or later on, this plan sounds very familiar to us. This concern about screening in terms of travel, this screening for symptoms, also the temperature reads, this all sounds quite familiar. In fact, many of it's listed and labeled in our 104-page plan from New Jersey. So those tips are great. You mentioned a tip that I think is very important. I spoke to the health director of the city of Long Branch this morning, and he asked about the size of the nurses' offices in schools. And he said, you may want to consider moving the nurse's office to a classroom or a large group area that's not occupied, because you're going to have more people that may have symptoms who have to be screened and they have to be spread out. I had not considered that. I even, one thing you mentioned was about the parking spaces. I don't even know if that was on my radar yet or on anybody's radar. That was a great tip there. Thank you very much. That was really a great. Now, a question I have about Shanghai or other schools in China. Once they opened, did they ever go back and close?
Yes, yes, there is so an example we can talk about is Beijing. So from the news, we all know that on the June 15th, the first local cases. Sorry.
That's okay. We can hear you perfect.
Okay. So after 57 consecutive days without any new local cases, on the June 15th, Beijing reported its first cases, and they responded and took action on that immediately. So on June 16th, so the next day, they locked down 10 communities around the wholesale market where the first cases were found. And so the started to run the viral test for all the individuals who are at high risk. And in terms of the education system, they didn't completely close all the schools, even in the high-risk area. So all the oldest graders, like the middle school and the high school, who are preparing for graduation and for tests, are still going to school, but they have to be tested with the viral tests. But for the younger graders, they all sent back to home and they resumed the distance learning. So that's how Beijing acted when emergency happened.
Was do you know if the emergency was actually a school personnel or a student, or was just somebody in the community?
Actually, it's just the community. So there was no direct contact with of the school personnel, workers in the wholesale market. But since it's a market, it spread quickly, and in order to tracing and prevent further, actually, I consider it a prevention actions instead of a control. So.
I think that maybe, it sounds like we're learning a lot of lessons, not just now, but overall from China. And it makes sense because they were the first country that had to deal with this. But it also, it clarifies something in my thoughts, is that there's a lot of conversation right now surrounding another wave or a closure in the fall. I didn't know where that came from. I assumed that the epidemiologist mentioned there could be a resurgence, but it does sound like Beijing saw something similar where they had 57 consecutive days and then all of a sudden they had to close schools. So there is a possibility that the lessons learned from China are things that could happen here 3 to 4 months down the road. But when schools close, I'm transitioning a little bit here. When schools close, the environment of learning begins to change. And I would love it if you or Lynn can speak to, what was the remote experience like in China? As New Jersey struggles with equity issues and internet connectivity and synchronous versus asynchronous definitions of learning, did China actually do something that was really great, or did they do something that wasn't so great? I think we can learn from both.
So what I consider, Lynn can add up things. What I consider was great was that the government, not only at the central government level, but also at the local government level, they closed the school. That's the first step. So there was no delay on that. So they first closed the school. Then they offered guidelines based on experts' opinion and recommendations. So they have expert committees regarding to the distance learning and remote learning and home learning. And they provide guidance to parents, teachers, and the school administrators. And after that, they put together some, actually it's a big platform, which is free to everyone. And it's an online learning platform. And that's provided. But the local government or the local school could also decide what they wanted to provide. So even if there is no material or resources from their school, they can go to the whatever the national examination is provided. So that's one thing. And it's a good point that the internet, I think in some part of China, the high-speed internet is very available, but there is still some remote areas, a lot of remote areas. The internet, especially the high-speed internet, is not available to allow any interaction with the remote teacher. So what they do is they put a free TV channel. Through the TV channel, they allow the students to learn, but it's just less chance of interaction. But they can still learn things at their own steps, their own pace.
So New Jersey, I think we feel like our schools are very collaborative and inquiry-based, project-based. There's a lot of team activities that occur in schools throughout our state. And we know that that's going to have to change with certain provisions because it tends to be very social. It's a dialogue back and forth. Is that similar to the expectation of students in China, that there's a lot of discussion protocols that occur in the classroom?
Yes, and I want to compliment what Zijia said just now. And yes, there's a lot of communication between the teachers and students. And besides what the government do, give some policies and guidelines, I should add that there's a lot of non-governmental organizations. They also offered a lot of very useful and important materials, such as the biggest early childhood education society, the Chinese Society for Early Childhood Development, and some important NGOs such as China. They offer some very important resources called the Morning Call for Babies. So that Morning Call for Babies not only for the children of 3 to 6 year old, they also offer to 0 to 3 years old. So I think that's important. And the other thing that for the kindergarten level and the teachers of every head teachers, assistant teachers, they will organize the communication online by WeChat. I don't know whether you know that WeChat is the very largest platform for communication in China. So they organize the kids usually 2 times a week. They will have some conversations with them. And the head teachers, they also have some individualized instruction for those kids who have some difficulties and they are not very like the conversation online. So the teachers will give them special help. So, and they also very pay attention to their social emotional development, as well as gives them some suggestions about health and hygiene.
Really interesting. Some of the lessons we are learning here are pretty similar. And that's our concern is I think we're also learning what didn't work for us by many parents who are concerned that we may revisit a remote environment in the fall or late fall. And some of the things we're learning is that this whole group concept, and it's kind of what you talked about, Lynn, this whole group concept is not great, but smaller conversations and individual tutoring, small groups are certainly much better and well received. So talk to me about schedules, because right now we have school districts working on schedules. And as Steve presented in the beginning, you have everything from a full return with protective equipment to a remote environment, then the hybrid in between. Were there any staggering of schedules to reduce the capacity of students? And there are any things that we can learn and share today? Oh, Zijia, for some reason, you just have to lean over a little bit so we can hear you.
Okay, I'm sorry.
Thank you.
Okay, is it better now?
Yes, perfect. Thank you.
Okay, perfect. So once the preparation stage is fulfilled, so the school will start. So after the campus is reopened and they will try to resume regular activities as regular as possible, but there are still a lot of changes. The scheduling things and Mike just mentioned both it's very important. So what they do is instead of a standardized schedule, each school should develop a customized strategic plan based on the school size, location, and the level of community risks. So one common practice is to adjust the school arrival and the leaving time. So for different graders, each grade come at a different time. This will prevent gathering at the same time. So parents sending their children to the school all at the same time is just going to get crazy at the entrance. So yeah, so what they do is they come at different times, and special rules and strict rules was also established for school bus use, and all parents come to pick up and drop off their children should wear masks. And as we talked before, the temporary parking spots that are made Sometimes it's not always available, but in this special time, they made more spaces available so that the traffic flow can be faster. This is all actions or practices to try to speed up, prevent people to stay at the same place for a long time. And one thing they do also do is a strict ban for personnel who can enter the campus. Only individuals who work and study in school can enter campus. Unrelated outsiders are not allowed to enter campus under any situations, including the parents. Our gym and exercise places are only open to school personnel. And the medical observation is performed for all individuals with fever or cough with no exemptions. All campus areas are set by blocks, and each block only allows certain amount of persons. On top of that, a daily morning health screening system is set up. So there's a station, health screening station is set up at the campus entrance. All individuals who are returning to campus are required to go through the daily morning screen. Hand wash or hand sanitizing is also required before they enter into the classroom and offices. And the lead teacher or the health workers of each classroom, of each class will check and observe the student health condition during the day. And Lynn had prepared some very good examples to show us.
Thank you.
Now I want to share my screen.
Great, I can see it.
Okay, I'll play it. Here, let me give you two examples to further explain what Zijia just said. The first example is from Shanghai, the reopening of kindergarten. Parents and guardians of Shanghai, they will first receive a letter from Shanghai Educational Committee. They said that we are going to reopen our kindergartens, and you have the free choice of whether to send your children back. If you choose no, we will reserve the seat for you and continue to provide online guidance and online resources. But if you choose yes, you must follow the seven principles or 7 steps. So let me give you an example of health screening when entering the campus to support what Zijia said. There are 4 steps to do the health screening. First step is they should stand in a line and take temperature one by one. You can see that this is a line. This is a line, and we call it a 1 meter line. This is a safe distance, and the children will stand on this every point on the ground, and then they will take temperature one by one. Now, this is the station, and this is established by the kindergarten teachers. It's a transparent shed for children to check their temperature. And please look at this picture. And the kids can just stand there, and the thermal screening kiosk will record their body temperature. And then, so this is the first time to do their temperature taking. And if someone's temperature is higher than 99.1 degrees, they will be taken here. This is called the temporary isolation room. And here they will take the second time temperature check. And this time, mercurial thermometer will be used. Here is the second step. Second step is hand washing at the entrance of the kindergarten. We know that washing hands frequently is a basic requirement of the morning health check, especially during this pandemic period. And children can wash their hands following these instructions. You can see the instructions here, or they can enter with the help and the guidance of these healthcare teachers, because there is no other adult allowed to enter the campus. So, and then this is the third step, morning health screening, and which is very important opportunity for them to find any suspicious symptoms. So by observing, by asking, and by checking. So this is the fourth step. And then the third step, this is the step 4. Children, after they enter the campus, they will take off their masks and store their masks in some places, different places you can see here. And this is interesting. And I want to specifically point out that in one of the press conference of MOE, Ministry of Education, they said that primary, middle school, and high school students should wear face masks when they to protect themselves and each other when they at school. And they can take off their masks if they're doing some outside exercise. And but for preschoolers, yes, for the 3 to 6 year old children, as far as I know, they could take off masks after entering the campus because they have already done the health check. And but the teachers, staffs, and faculty at the kindergartens, they should wear masks at the kindergarten. So this is the Shanghai case, and this Shanghai case is for the kindergartens. And then I will give you a brief introduction of Beijing case. Zijia said just now, yes, that's a very big data tracing system. In Beijing primary and middle school, they use an electronic monitoring device to check the body temperature of all people who enter the campus, and the data is collected at the same time and saved in a big data tracking system, which there's very strict protection, safety protection. And then the data system is available for all school districts and all related departments, such as education department, transportation, and health department. So if any positive case is detected, the comprehensive management system will be activated. So we will find this one who should be checked. So these are the 2 cases of the health screening system. I think I can support that points. Let me first stop.
That was amazing. First of all, I just have to recap real quick before we transition here. A transparency shed. We've never even heard of such a thing here. Thermo screening kiosk. These are all new things I guess we have to look forward to. Temperature isolation rooms.
Yes.
I mean, that is extraordinary. So that's the after you leave and you test and you need to confirm or take a second temperature. And then these portable hand washing machines upon entry. And I think the most interesting of all that you said is ages 3 to 6 operating throughout the day without masks on, which has been a topic in the United States right now in terms of if that's necessary or not. Great information. Thank you.
Yeah, I also want to add that
I'm sorry, you're gonna have to lean into the to your left again. Yes.
So
yeah.
I'm sorry. I just wanted to emphasize that the butlers can take off their masks because they went through a very strict checking procedure every day. So that's the way to help them to play and study more like before. But without that, the masks is still recommended.
So I want to touch on that a little more too. So we haven't heard this yet. We've heard about temperature screenings loosely in terms of an obligation to do it. We've heard about screening for symptoms. But an actual physical health screening is what I saw there. I saw a physical health screening looking at ears, looking at throat, looking at eyes, which would take a tremendous amount of time, I would guess, to get children in. But that gave them a bit more freedom during their day. And this is the first I'm hearing of that. But I think it's an excellent protocol.
Yeah, we all know that the asymptomatic patients are also dangerous. So that's something to help to identify those individuals.
great. Great. Wonderful. So do we, Steve, is there anything else that you wanted to add, or do you want to jump in?
The only thing I'd add is that folks can go to the Facebook site and, of course, pick up this video later today or tomorrow. And we will have the matrix materials with the state and country information. I'm sure that Dr. Lee would be happy to provide her slides if people want to see the detail, not just in the video. And other than that, take it away.
So I do want, there's a question that just came in about getting access to this tool, Steve. Where would people get access to this?
On the Facebook site for moving schools forward.
Great.
Associated with this project. But if anybody has trouble, just email me at sbarnett@NIEER.org and I'll send them a copy.
I actually, just to draw your attention to the attendees, if you're taking a look now, Ernie just posted it in the chat room or the question and answer section, so you can always copy and paste that onto a document. Thank you, Ernie, for doing that. That's great. I do want to open it up for some additional questions or additional comments. So if you take a minute, if you have a particular question that you would like to ask some of our guests today, that'd be great. And as you're thinking about some questions, Zijia or Lynn, do you have any additional comments that you want to make about some of the research?
Actually, we found it interesting that there's daily monitoring system. There's daily monitoring system, which requires a daily report for all personnel's health conditions, healthy with symptoms, all conditions. A daily report is required, and 3-time checkpoints during a day, morning, noon, and afternoon, as well as all-day observation is also required. And the tracking, logging, and the reporting all personnel who is absent, leaving early, sick leave, and leave for personal issues also required. So the very strict and comprehensive monitoring system for all school personnel. And their sanitizing system is also strict. So they leveled up the requirement for sanitizing and disinfecting the campus. Like they need to clean up everything before the first class, and the ventilation is required for all indoor areas. And it requires to ventilation at least 3 times a day, and not less than 30 minutes each time. And all shared classrooms, such as music, dancing, or gym, they should be disinfected between different groups use the space. And periodical and frequent disinfecting is also required for spaces like restroom, entrance, and the garbage collecting space. And we want to emphasize the kitchen and the dining room. So all the tables, tableware, and need to be disinfected. On the staff who work at the dining room or the kitchen, their clothes, their uniforms should also be clean. And only the preset combo meal is offered. So the children could not freely choose what they want like before, but they are only offered a combo. This is a way to prevent them to stay in the cafeteria or the dining room for a long time. And they are also required to wash hands before and after dining and clean up their tables. And as for the school bus, I mentioned earlier that school buses are used very strictly. So what they do is all school buses are equipped with body temperature thermometer for the school bus especially. And they also equipped with masks, hand sanitizer, disinfecting spray, even vomiting bag and medical waste bag. And disinfecting is required after each use. So that is very strict. And the drivers should wear masks and gloves during driving. all staff and students or children who take the school bus are also required to wear masks and get temperature checked before boarding. Individuals whose body temperature is over 99.14 degrees is not allowed to take the school bus.
You shared a couple of things I haven't heard yet. First of all, the temperature that we're hearing here is 100.4, so I don't know why there's a difference. That is interesting.
More margin for error.
Yeah, I guess so. It makes sense. It would definitely impact a lot more people, right? I want to get to a question that's here from Dr. Latimer about communication. And it talks about, can you share a little bit more about the communication from teachers to parents, but also when a child is actually referred to the isolation room for additional monitoring? What does that communication look like? Are parents picking up children, or do they have to be removed from school immediately? Do they have to be tested? Do you know anything about that?
Okay, I will try to answer first. So when you bring up the communication, I will talk about the distance learning first. So the WeChat is an app like a WhatsApp or Facebook message. So parents and the teachers are communicating frequently through the app. And there is also a group chat. So the parents could also share their experience or their questions and get support from their local small group. And that's during the distance learning or remote learning school close period. Once the school starts, they want to start that as normal as possible. So but I mentioned that the parents are not allowed to go into the campus, so they cannot face-to-face talk to the teacher directly. But the WeChat is still available, so that's something they could touch on a daily basis. That's communication between the parents and the teachers. And for the isolation room, so at the entrance, the purpose of the isolation room is that, as we mentioned, the temperature, the cut point, the bar set for the temperature could be too strict. So they give the chance for people to get second, third check. So if maybe you just run into the campus and your temperature is high. So they give the chance for you to come down and to stay in the isolation room. It's more like an observation room rather than isolation. So they're given a chance to take more temperature. So, but some urgent situation is that the children get really high temperature. So this child will not be sent back to classroom to get contact with other children. So what they do is they will reach out to their parents. Then the parents will pick up their children for any further diagnosis or treatment.
Yeah, I want to add one example to add the use of temporary isolation. And that, can I share my screen again?
Yeah, sure.
Mm-hmm. Here, we can see, oh, sorry. Yes, this is an emergency, this is an isolation, temporary isolation room. Besides what Zijia said just now, it can be used as an observation room. And I think it's more important use of this room is can prepare for when the emergency situation appears. For example, one day, a girl of 4 to 3 year old, she omitted when she was playing. So at that time, the kindergarten activated an emergency plan at once. Then the healthcare teachers took the girl to the temporary isolation room. And you can see the healthcare teachers, she wears a whole PPE, all of the things. And then at the same time, all the other staff and the teachers, they disinfected the environment immediately, and the kids' parents was informed at once. And then after that, there will be special personnel to follow up the whole case. So that is the use of the temporary isolation room. Yes.
Thank you for sharing that. There's a word that we're throwing around here in New Jersey, and it's hybrid. And I really haven't heard you talk about that much. It sounds like China went back full capacity, even on buses. Am I wrong, or that's kind of what I heard?
Hybrid.
Hybrid meaning a combination of remote and in classroom. Maybe you go to your classroom once a week or twice a week, and you're remote the rest.
Our observation is more like the example I just mentioned. The applied to the same grades. So for the graduation graders, are following the regular daily instruction schedule. But once the school recloses, the younger children are get back to home and start distance learning immediately. So it's kind of a hybrid, but it's not hybrid at individual level, but more like at a community level or at the grade level.
Right. So in New Jersey right now, there are many districts that are planning for a partial capacity return, which makes it really challenging for people to go back to work, as you can imagine, where 50% capacity were on buses and maybe 50% were in the classrooms. So it sounds like China just continued on a path of 100% capacity until they closed, and they went full remote.
Or you did it by age, but it was whoever is in full time. That's exactly right.
Where did I wonder where the concept emerged that reducing capacity was a really good option. I guess it's easier to cohort and track and trace, right? Maybe that's where that came from. I don't know. Here's a question that popped up regarding the training for professionals. Is it exclusively to medical professionals in the schools, like nurses, that are trained, or is everybody trained in this process?
Yes. Let me take Shanghai as an example. Before the official opening of the kindergartens, all of the teachers, including the nurses and the healthcare teachers, assistant teachers, they are all have been trained, and they are taught and about how to the whole process of reopen that day, and they will do a practice run, and I think that's very, very important. And when there's no children and the teachers stand there and they will do all the procedures, and after that there will be a working group to monitor and supervise all of this. If they have meet the standards, then they will reopen. If not, they will adjust and then they will do some change.
So Lynn, you're telling me that the medical screening process, is that exclusively just for nurses to do, or you have teachers involved in that process as well?
Nurses and as well as the healthcare teachers, because there is one class, there will be one healthcare teachers and the two other teachers. One is the head teacher and the other assistant.
Oh, that'll bring up a lot of conversation with their Nurses Association in New Jersey. They would love to certainly have more people assisting if the process looks like this. Great. Are there any other questions out there? Any other comments that you want to add to our team today?
While we were waiting for someone to come in on chat, I will just add, I think one of the coolest ideas is that everybody did practice runs without the kids first. And then so everybody learns how to do them, and B, so they can work out all of the things that didn't work as planned. And then that there is a work group for every school whose job is basically continuous evaluation and improvement of the process.
Absolutely. So what about, there's a couple that have come up. One of them is about funding. How did China fund the additional Thermo tech, and the protective gear. You did mention it, Lynn. You mentioned it in terms of the government provided that to the schools, right?
Provide what? Sorry.
I'm sorry. The screening and the protective gear, the PPE.
I believe the public education system is more popular. A large proportion of the schools are public schools, so they're all
Can't hear you.
Oh, so she's saying you're saying the public schools actually receive them, right?
Yes.
Yeah, that's.
Yeah. The most of schools in China are public schools, especially for 1 to 12 grades.
Gotcha.
So was there additional money, or did the government, the central government, the city government purchase these things for everybody?
Yes, I think yes, just as you said that on the June the 2nd, so all of the public kindergartens are reopened, but for those private kindergartens, government said you can reopen if you meet some requirement, but there is no exact funding for those private kindergartens. But you know that there were another kind of kindergarten in China, that is the private-owned kindergartens subsidized by the government. So this kind of private kindergartens, they can get some fundings or investment from the kindergartens. But for those public kindergartens, where is a funding, as far as we know, the local government, for example, the municipal government or the province government will invest, but we should find some more information to confirm this, I think.
That's good. So, we are attempting to identify compromised students, health compromised staff. I didn't hear that mentioned. If somebody were compromised in terms of a particular health disorder, disability, or condition, were they prohibited from returning, even if they weren't symptomatic? If they were compromised in some way, were they asked to stay home, or did everybody report back, including students?
Yes, this monitoring system is for the teachers. So anybody shows any symptoms recommended. Actually, they should not come back to the campus. And they could perform stay-home observation, quarantine themselves, self-evaluation. If the symptoms continues, they should go to get medical diagnosis or treatment. Yes, it's the overall. My observation is that the policy is quite strict. So I don't think there are quite compromise on that. So anybody who get into campus should be healthy.
Yeah, I was actually thinking more about pre-existing conditions, such as diabetes, hypertension, heart disease, without having symptoms of COVID. Were any of those people precluded?
No, that's for pre-existing conditions that are not correlated with COVID-19. That's not in the requirement or the prohibition of the policy. Yeah.
And then I just want to ask this one as a last question here. In the United States, particularly in New Jersey, we're focusing a lot on mental health and wellness in terms of social emotional learning for a strategy for that. We didn't hear or talk about that. Is that a focus that is happening in China or in other countries?
It is actually a very big concern of the Chinese educators. Some recommendations from the expertise about how to socializing children during the distance learning or school closing period. So recommendations like getting more interaction with their teachers, with their peers, through internet through the advanced technologies, of course, and get out to the playground when the community is open, as well. And exercise, the students' health in the home is also a big concern. So they send out the instructional videos about how to exercise at home and how to be healthy at home. So that's some way to help the parents to keep their student healthy mentally.
Yes, I want that add a thing more. Yes, I think the Chinese government.
Lynn, can you move in a little bit so we can hear you?
Okay, I think the Chinese government and the Chinese experts, they are now paying more and more attention to emotional learning. And besides just that, I think there are a lot of NGOs, such as the China Society for Early Childhood Education, they organized a group of experts to give lectures to the teachers, to the parents, and they give a lot of advice and suggestions for how to develop children's social emotional learning. And besides that, they will give them some they will give them some videos and activity suggestions. Yes, so I think that's a very important point for our kindergarten,
Good.
Especially the curriculum development.
That's great. Well, I want to stop here. We've reached an hour and 1 minute, but I thought the conversation was extraordinary. I actually have learned a tremendous amount, and I think anybody who's watching can take things away and immediately apply them. So I just want to thank Dr. Lee, Dr. Barnett for taking your time to come out and share some of your wisdom. And I'm sure that superintendents throughout the country and possibly the world will benefit from watching this video. So thank you very much for taking your time. Enjoy the...
Thank you.
You're welcome. Happy 4th of July is coming up this weekend. I don't know where you two are, but I will be here eating some hamburgers and hot dogs, and Steve probably will be doing the same. Okay?
Thank you.
Thank you. Have a great day. Have a great weekend, everybody. Thank you. Bye-bye.